Well, good morning, everyone. Thank you for attending today's Medicare Transition webinar. I'm going to cover quite a bit of information today. So again, you can ask questions. You can fill in the little questionnaire, the Q&A item, and Mike Farrer will be able to view the questions and let me know, and then I can go ahead and respond and try to clarify items for you. This webinar is being recorded and will be available on our website probably within the next week or so. Okay, so in case you wanted to come back and view it again, you can do so on demand. Okay, all the forms and everything is also available on our website. You can always download any of the forms or simply give our office a call at 510-628-3000, and any of the agents will be able to provide you and email you the links, the forms, and so forth, or we can go ahead and provide that to you. Okay, thank you. All right, with that, we're going to go ahead and begin. Okay, today we've pretty much done our introductions. My name is Ish Pina. I'm the Assistant Benefits Manager over the Healthcare Unit at ACERA, and I do the education regarding the health plans and Medicare and so forth. I'm assisted today by Mike Farrer, who's our Communications Manager. We're going to do a quick overview for Medicare, and then we're going to talk about ACERA and the Medicare mandate that ACERA has. We're going to talk about Medicare and how it works, and Medicare plan options that ACERA has. And then, of course, we'll have questions. Okay, who is eligible for Medicare and who's involved? Well, typically it's anyone who's 65 or older, under 65 if you have a disability. And it's not just necessarily that you have a ACERA approved disability. It's the Social Security has their own criteria as far as what they consider disabled. So if you've had a disability for at least over a year, you can contact Social Security, and if you fit their criteria as far as being disabled, they may grant you your Medicare early. Okay, so we do have some young folks that are under 65 who already have their Medicare due to a disability. Okay. People at any age with ESRD or Lou Gehrig's disease, and of course, Social Security Administration and the Center for Medicare, or CMS, they're the ones that pretty much control the approvals and granting. All right, moving forward. Okay, so if you're currently receiving a Social Security check, okay, they say that you're automatically enrolled, and so that they would automatically send you your Medicare card prior to your age 65 birthday. We would like to tell you that even if you are collecting Social Security already, you may want to go ahead and just give them a call just to check in and say, hey, I'm going to be turning 65 soon. I just want to make sure you have all my current information. That way I can get my Medicare A and B. And that's a good chance for them to check to make sure they have everything that they need, everything's current, and then they can go ahead and start here on the process for getting enrolled for the Medicare Part A and B. Okay. Medicare Part B premium will be deducted from either your Social Security check or you'll be directly billed. Okay. Typically, for most of us, as long as you put in all the quarters, then Part A is typically free. And I'll be covering that in just a little bit in the next coming slides. But Part B, there is a premium for the Part B, and that must be paid. Your Medicare card will be automatically mailed to you. Okay. Note, some retirees or dependents who are disabled, again, may be eligible for Medicare earlier than 65. Okay, which is good because the Medicare plans are lower in cost, so it would save you some money. Okay, so if you're not collecting a Social Security check, then you would have to go ahead and still reach out to Medicare, Social Security, and let them know that, hey, I'm not collecting Social Security check. I'm going to turn 65, and I want to go ahead and apply for my Medicare. Okay, but I don't want to. If you choose to not collect Social Security at that time, that's fine. That's totally up to you when you want to collect it. But you want to reach out to them, let them know that you do want your Medicare, so they can go ahead and start the process of that. Okay. So with that, they will bill you quarterly, is what they do for the premium. So they'll send you a 3-month bill. Okay. And so you must pay that. Otherwise, they will disenroll you from Medicare, and which will, of course, disenroll you from the plan that you're in. Okay. So you want to make sure that that premium is paid. So you want to call Social Security Administration at that 1-800 number to obtain information about enrolling. You can do this online. people have gone online and just done it online. If you reach out to them, they'll explain everything you need to do. That way you can go ahead and get that going. Okay. See, Mike? Okay. Now, this happens quite a bit over the years. Members will say, well, why do I have to get my Medicare and change over if I already have a good plan? I like my doctors, I don't mind my copay and so forth. Well, the whole reason is that the board has mandated that anyone who becomes Medicare eligible must transition over to a Medicare plan. Okay. Many years ago, members would, they'd get their Medicare and they would just still try to stay on to our regular HMO plans that we have. And then we try to get them to the Medicare plan. So, oh, no, that's okay. I'm fine where I'm at. Well, what happens is if you get your Medicare and you don't transition over, what happens is the carrier charges ACERA a surcharge on the backside. We don't push that additional premium onto you, but it becomes a premium that ACERA has to pay on our side. And what ended up happening is that surcharge bill grew to be a substantial amount of money. So the board said, okay, we should not have to be paying this additional fee to the carriers just so that someone can say, well, okay, well, if I don't like what my doctor says, or I go to all the time at my medical plan, I want to be able to take my Medicare and go outside and go get a second opinion. Well, the vast majority of members never ever did that because they always went with whatever their doctor said, or they got their doctor to provide them another referral. So ACERA's paying all this additional money for no reason. So they made a mandate. And so now if you become Medicare eligible, you must go on to a Medicare plan. Okay. So again, that will save you some money because the Medicare plans are a lot lower in premium than the non-Medicare plans. And you'll see that in just the coming slides. Okay. Go ahead, Mike. Okay. And here's an example of how you can save some money. Okay. In this example, we have a member who's 17 years of service, okay, turning age 65, becoming Medicare eligible. They're on the Kaiser HMO, okay. The current premium for the HMO this year is $810.72. This person who has 17 years of service, the MMA that they're eligible for, MMA, monthly medical allowance that ACERA pays, okay, is $433.99. That leaves a difference to come out of this member's retirement check, and that's out of pocket of $376.73. The same member becomes Medicare eligible, enrolls in Kaiser Senior Advantage. This year, that premium is $382.21. Because of their years of service, we're going to subsidize $382.21, meaning their out-of-pocket cost monthly now is $0. So that's $376.73 that gets to stay in their check monthly. That's a nice little chunk of change to be able to keep in your pocket, right? Not only that, but on the Senior Advantage, your copays drop down. On the standard HMO, your copay is $15. When you get into the Senior Advantage, it drops down to only $10. So it's, yes, the difference of $5. And for some members who I've spoken to who are on quite a few medications, at $5 a pop, that adds up quite a bit also. Okay, so they're saving all around on that. So that's one of the good reasons why you want to take your Medicare when you're eligible for it and get over to a Medicare plan and start saving some money. Proceed. What is Medicare Part A? Everybody starts hearing all this. You got your Part A, B, C, D. Okay, well, here I'm going to explain. Okay, Medicare Part A is what is coverage that provides you the hospital insurance portion. Okay, it helps to pay for Medicare-approved hospital stays, skilled nursing facilities, rehab, not long-term care, but like hospice care, home health care, things like that. Okay, so that's what Medicare Part A takes care of for you. And for the vast majority of us, as long as you put in your quarters, then Part A is basically free. Okay. Go ahead, Mike. So, enrolling in Medicare Part A, okay. Again, for the majority of Medicare Part A costs nothing because you or your spouse or your ex-spouse were married for 10 years, paid Medicare taxes, are working and earn the quarters to get it. Okay, so as long as you got 40 quarters, it's basically free. If you only have 30 to 39 then there is a monthly cost. And if you didn't ever pay in, then of course there is an actual cost. The actual cost is upgraded from I got there 458. It's actually 471. So I'll be making that correction. They did change that. Okay. So for 2021, it is all the way up to a max of 471 if you don't have the quarters. Okay. Again, if you don't enroll in your Medicare when you become eligible, okay, then you may be assessed a late enrollment penalty. Okay, so you want to make sure that you're enrolling when you can and not delaying. And there's a time frame for that, and I'll go over that in just a little bit. But you may have to pay a higher premium for twice the number of years you could have had Part A. Okay, so let's say you could have got A this year, and you don't do it, and you wait 2 years, and then finally you decide, okay, I'm going to go ahead and get it. But now you're going to have to pay a penalty twice the years. So if you waited 2 years, then now you have to pay a penalty for 4 years. Okay, so we want to make sure that you enroll when you can, so to avoid those penalties. Okay, go ahead, proceed, Mike. Okay. What is Medicare Part B? Part B provides the medical. Okay, it helps to pay for Medicare approved doctor services, outpatient, certain preventive care services, diagnostic tests, things like that. Okay, things that Part A doesn't cover. And you do pay a premium. Everybody pays a premium for Part B. For most Medicare individuals, the basic premium in 2021 is $148.50 for Part B, okay, which is the lowest standard premium for the Medicare Part B. Some members will pay a higher amount. What they do is Social Security looks at a 2-year look back. They look at what you reported to your IRS taxes 2 years ago. Okay, that's always a two-year look back, and they look at what your income was, and then they base it upon that as far as what your premium is going to be for the Part B. They got a chart coming up pretty soon. Okay, Part B also helps take care of many supplies for your medical items too. Okay, proceed, Mike. Okay, so enrolling in Medicare Part A and B, you want to make sure you can go online to Social Security, or you can call that 1-800 number, 1-800-772-1213. Well, I know we're doing this is still in COVID. I know we have that you can visit your local office. I believe they may have opened up, but are really limited as far as who they let in. You'd have to check to see who your local office is to see whether or not they've actually reopened and allowing walk-ins. So you'd have to give them a call. Because going down to the Social Security office is kind of like going to DMV. You want to make sure you make a call and have an appointment. Otherwise, you want to make sure you pack a lunch because you might be there for a long time waiting. Okay, if you make an appointment and they do have you come in, it's usually pretty quick. Is what I hear from members. They've made appointments and they're able to get in pretty quickly. Okay, to view an agent and get assisted to get enrolled. Okay, you want to fill out an application for enrollment in the Medicare Part B and submit to the security office. Okay, all right. Now remember, submitting an application doesn't automatically mean that you're enrolled. Okay, so you want to Social Security has to make that determination. They'll look at your record, see how many quarters you've worked, did you pay into the system, things like that. Okay, you will receive a letter from them. Okay, enrolling in Medicare Part B at the right time is critical. Okay, so again, it's a 7-month enrollment window. Okay, the month you turn 65, your birth month, okay, 3 months before and 3 months after. Anything past that, the 3 months after your 65th birth, then you will be assessed a late enrollment penalty. Now for Part B, unlike Part A, the Part B penalty is permanent. It's a permanent penalty on top of the premium, and that you'll pay for the rest of your life. Okay, as long as you have it. Again, 3 months prior to your 65th birthday is you can't go too early to try to apply, because they'll say, oh, you're still too early, you're not within your enrollment window. Okay, so now the thing you want to keep in mind is when your birthday falls. If your birthday falls on the 1st of the month, then Medicare bumps you up a month. So for example, if your birthday falls anywhere within the month, your birthday month, the Medicare becomes effective the first of that month. If your birthday falls on the first of the month, then your Medicare will be effective the first of the prior month. Okay, so you gotta. It all depends upon if your birthday falls on the first or not. So you want to make sure that you reach out to Medicare at least. I would say at least 90 days from 90 days from your birthday. Go ahead and give them a call and let them know. They can check their system and say, okay, yeah, we can go ahead and help you out, or you got to wait a few more days till you're within the 90 days, and then give us a call so that we can assist you. Okay, so again, it's a lifetime penalty of 10% for each month period that you did not enroll into the Medicare. So you want to make sure that you're getting that done as soon as possible. Okay? And there's a reason why. I already showed you that you can save some money by enrolling in Medicare and getting into a Medicare plan, but ACERA'S IMBRP plan is another bonus. Okay. Right. Okay. Now, if you're still working, okay, employer plans can protect you from an enrollment penalty. So we do have quite a few members who continue working after becoming 65, okay, and that's fine. You can go ahead and waive your Medicare from getting your Medicare and not have to worry about paying a penalty as long as you're on an employer plan, okay? Of course, once you stop working and are going to lose that employer plan, you need to make sure to reach out to Social Security and say, hey, I'm going to stop working. I'm going to lose my employer plan. Now I need my Medicare. And they can take a look. There is a form that they will send to your employer for them to fill out, and they'll sign, so certifying that you were on their plan. Okay, and then what that does is that lets Social Security know that, okay, yes, they were on the employer plan. We're not going to charge them this penalty for enrolling beyond the time that they should have enrolled from being age 65. Okay, so basically, again, you can delay Part B until you can only be on your employer plan. You can enroll in Part A and B and have Medicare and the employer coverage, but remember you're paying for a premium. You're paying that Part B premium, and you're on your employer plan. It's kind of a waste of money, is what I would say, in my personal opinion, because an employer plan is always primary. Okay, if you had your Medicare and you're on an employer plan and you went to a doctor, the doctor tries to bill Medicare. Medicare is going to say, no, we are not primary. You have to put the claim to their primary, which is their employer group plan. Okay, because Medicare is not going to pay anything until the group plan pays what they're going to pay. And basically, the group plan usually covers 100%. So there's really nothing else beyond after they take care of it. So otherwise, you'd be paying Medicare Part B, and they're not going to be paying anything. Medicare is going to say, oh, thank you for the premium, but we're not paying anything because you have an employer plan that's going to cover everything anyway. Okay. So again, I would say if you're still working on an employer plan, just contact Medicare, let them know, hey, I'm still on my employer plan, still working beyond 65. So I'm going to waive my Medicare at this time until I come off my employer plan, and it'll be all good. You just got to remember to reach out to them when you do decide to stop working and get off that plan. Okay. See? And here's an example of how the Medicare premium is looked at by Social Security. Okay, so here you have a file for a tax return, 88,000 or less, or filed joint tax, 176,000 or less, or even filed married. The first premium is $148.50. That's the base amount. Let's say you file your tax returns and you're at $140,000. Okay, on an individual. So that's 1, 2, 3, 4. The fourth window down, above 138,000 up to 165,000 as an individual. You slide all the way across, you see your monthly premium would be $386.10. Okay, so you can see how the higher your income is that you're reporting to the IRS, where you would fall on this premium scale. Okay, now there are times where members may fall into this higher scale, It could be because they either got an inheritance, they sold some property. They may have pulled some money out of an IRA or a deferred comp account. And it may have been just been a one-time withdrawal. Okay, so you're not going to be at that high level of 140,000 all the time. It's just this one time. Okay, well, Medicare will do a review. They'll take a look the next year. They look at another 2-year look back. They'll look at the following year, and they'll see that they're not at 140,000. They're down at 88,000. That one-time withdrawal of those funds or issuance of funds to you made you look higher than you really were, and they'll do an adjustment. You can always reach out to them and appeal to them that, hey, I don't really make all this money. This is a one-time thing, an inheritance, or whatever the case be. And they'll take a look at it and they'll work with you. But you always want to talk with them. They're pretty nice, and they do work with you. Okay, so just so you're aware of that. Now, this is for the Part B. Now, ACERA has a program called the Medicare Part B reimbursement. And I'll be coming to that slide just a moment. Go ahead, Mike, advance the slide. Voila, here we go. Okay, this is a non-vested benefit, okay? And this benefit is granted to our retiree members only, okay? So it's only for the retiree, it's not for dependents, okay? So if your dependent becomes a Medicare eligible, we're not gonna be giving you a reimbursement for their Medicare premium. This is only for the retiree member who worked for the county, okay? Now, in 2021, this reimbursement is $148.50. Okay, so basically, you get your Medicare, you complete the IMBRP reimbursement plan form, you make a copy of your Medicare card that shows you have Part B, and you supply both of those into ACERA and on your monthly benefit. If you ever look at your statement, you got your base amount, you got your cost of living line there. Okay, right below that, you'll see a new line that'll say IMBRP reimbursement plan, and you'll see a credit of the $148.50. So Social Security is taking the $148.50 or whatever premium they're taking for you for their Part B out of your check or pocket over there, but here in your ACERA check, we're giving you $148.50. Okay, and to qualify for this, you have to have at least 10 years of a service. You have to have worked for the county and retired, and we got you with 10 or more years of service, or have a service-connected disability. Okay, and of course, you got to provide us proof of Medicare Part B. So basically a copy of the Medicare card that shows you had the Part B. Okay, we have quite a few members who will send in the card and they only have Part A because they never went back to get the Part B, but we can't give you the reimbursement because you don't have Part B. You got to provide us the card that shows you have Part B. Okay, and we need both documents. We need the form and we need the copy of the card that shows you got the. Okay, now again, this is not a retroactive benefit. We talk about this in our seminars, it's in our open enrollment information, so it's out there. So we can't, I'll have a member who they have lunch with another member and they're talking about it and so, oh yeah, my reimbursement really is nice of ACERA to give us that. So I don't have that one, I got Medicare. So then they send it in and they're asking me, well, I got my Medicare, last year, can you go ahead and give me retro back? No, we don't do, it's not a retroactive benefit, okay? It's when we get your form and a copy of your card into our office, we'll go ahead and start the benefit credit, okay? We're not gonna give you a retro back because if you weren't looking at your material or responding to any IMBRP solicitation that we may have put out there, okay? So you gotta make sure that you fill out the form, make a copy of the card and get it into our office so that we can grant you your $148.50. Okay. Again, it's not automatic. You must complete the form and send in the card. Okay. And also, enrollment in a Medicare plan or medical plan with ACERA is not required. We have plenty of members who are become Medicare eligible and they choose not to be on our Kaiser Senior Advantage plan or take a Medicare plan through the VA benefits. They may have another agency that they work for, or they may be on their spouse's medical plan. And that's fine. It's not tied to the medical plan whatsoever. This is a years of service benefit. So as long as you have the 10 plus or a service connected disability, you can go ahead and submit the form and the copy of your card, and we can go ahead and grant you your Medicare Part B reimbursement. Okay. It's always a good thing. All right. Okay. Part D, premiums by income. Okay. Part D is the drug plan portion of Medicare. Okay. Now, it takes care of the prescriptions. Now, Advantage plans have Part D already mixed in with it. It's part of the bundle. For example, our Kaiser Senior Advantage plan that ACERA has, Part D is already built into the plan. It has a prescription coverage. Okay, it's only $10 for your prescriptions for a 100-day supply. Okay, so you wouldn't have to apply for a Part D plan, so a prescription plan, because it's already part of the Kaiser Senior Advantage. Okay, so there's that other premium that I had mentioned earlier, that $382 for the Kaiser Senior Advantage. That's it. And Part D is already built into it. You don't have to worry about trying to get another prescription plan also. Now you will get a truckload of mail trying to solicit you to enroll into their plan. They're going to try to offer you all kinds. Oh, we'll give you this duffel bag. Your premiums are going to only be like $3 or 25 cents or whatever the case is. Hey, a lot of these offers are too good to be true, because they are too good to be true, because they're not really true on all of these. They're trying to wheel you in. That way they can get you in. And then there's other costs that they're not telling you about just yet. Okay. So you want to make sure that you don't just fall into some of these little scheme things, because just get the duffel bag. Because if you enroll into a prescription drug plan outside of for example, the Kaiser Senior Advantage, you enroll with us and you sign up for another prescription drug plan, it will bump you out of the plan. And I know you don't want to lose your medical coverage. Okay. So don't pay attention to all that other stuff. If you're going to go with our Kaiser Senior Advantage, it has everything all bundled in it in a nice one neat package. So you don't have to worry about that. Okay. If you're choosing not to go into Kaiser Senior Advantage with ACERA and you go through via benefits for Medicare plan, they will sign you up for a Medicare Advantage plan if you choose to have a Medicare Advantage plan, or they can sign you up for a Medigap plan or medical supplement plan. And then they will also enroll you into a prescription drug plan, which is Part D for your prescription portion. I'm going to cover that in just a little bit. Okay. So getting back to the premium for Part D, you can see the scales for the salary of what you're returning in as far as your tax returns. Okay. Your plan premium. So basically, if you have $88,000 or less, if you're individual, $176,000 or less, if you're filing joint, you're not paying a premium for the Part D. Okay. If you're above that, okay, let's say you're at $90,000. Okay, it's the second row there. You see it'll say $12.30 plus your plan premium. So basically, you're already paying your plan premium, but now you're going to pay this additional $12.30. This is what they call is a monthly income monthly related adjustment. Okay. Now it's not necessarily that you're paying to have Part B. This is something that Social Security and Medicare has designed, that if you're making over a certain dollar amount, as far as income wise, then you're going to pay this additional adjusted fee, because you're doing, as they feel, you're doing pretty good as far as income. And you do have to pay this. It'll come as a bill, separate bill. You do have to pay this. Otherwise, they will disenroll you from your Medicare. So they kind of got you in a vice, unfortunately. And we'll all be there, depending on where we fall with our income. Okay. So again, some of these can start to build up pretty quickly, depending upon where someone falls income wise. So you got to be sure you pay attention to these billings when they come in and pay them back to Medicare. Unfortunately, ACERA does not reimburse these like we do the IMBRP. Okay. However, if you went through via benefits, over there they have the HRA. I believe you can go ahead and submit this in to them, and they can go ahead and look to reimburse accordingly. Okay. All right. Next slide. Okay. Types of Medicare plans. Now, there's two types of Medicare plans. It gets kind of confusing sometimes, so I'm going to kind of go over these so you kind of have a good understanding. You got your Medicare Advantage plan, okay, under the gold bar there. Okay, basically, it's like the HMO. Your Medicare is assigned to the selected carrier, okay, and you have a medical group, okay. You have a primary MD that you're select. That's when you go see. You must get your primary MD to provide your referral to go see a specialist. That makes sense, right? Most Medicare Advantage plans have a prescription drug plan built into it as part of the plan. So you always want to make sure you inquire, make sure. The Archives of Senior Advantage does. It's all part of the package, okay? Copays may vary. Okay, for the Archives of Senior Advantage, the copay is $10. Okay, if you go through via benefits on the individual side over there, it depends upon the carrier you select. Some carriers and group Medicare Advantage plans will have some have no copay with a higher premium, and some have a small copay with a lower premium. So you got to make sure you ask the questions, and they'll be able to provide you with that information as far as what you're getting into and what you're having to pay. Okay, and of course, with those, you must reside in the service area of the plan. Okay, so basically, these are all tied to where you reside, your zip code. Okay, and there's a reason for that. Remember, say, well, if I'm paying the premium, well, I should be able to go wherever I want. Well, the thing is that your carrier is in that specific area. Okay, and so is your primary physician and so forth. So they contract with people and other companies in that area to make sure that they have the necessary supplies and, like, for example, air tanks. If you need an air tank, there's a company that's in your area that they contract with to be able to provide that. Now, if you live way, yonder, that air tank company may not drive all the way over where you are now because that's way out of their zone. Okay, so there's a lot of things that, as far as the reason why they have you make sure you're in the residing service area of the plan. Okay, now Medigap plans, for us, and they're also known as supplemental plans. Those plans you're not assigning your Medicare. Okay, you don't select the medical group, and you don't select a primary MD. Okay, you can go see any MD that accepts Medicare nationwide. Why? Because on the Medigap supplement plans, the Medicare is still primary and you have control over that. Unlike the Medicare Advantage plans, where when you enroll, you're assigning your Medicare to that carrier. You're letting Medicare know that, hey, this is my insurance, this is my doctor, this is where I'm going to go. Okay, and they make sure that the Medicare is assigned there so that as they provide services, Medicare is taking care of them on behind the scenes with the billing, all that is there. Okay. But with the Medigap plans, you retain the power of your Medicare. So you get to decide where you're going to go and who you're going to see, and you have your Medicare. So let's say you're here in California and you need something done to your eyes, or your specialist to do some kind of procedure. And the leading specialist for that procedure is, let's say, Miami. Okay. And they take Medicare. If you reached out and said, hey, I have this I'd like to have an appointment with you. You take Medicare, and it's yes, come on down. Okay, you can go ahead and make your way over to Miami to see that very best specialist, and Medicare will go ahead and take care of that because that doctor does take Medicare. Medicare is nationwide, so wherever throughout the United States, you can go see any doctor, any specialist, whatever, no referral, and use your Medicare. Okay, and then once Medicare does pay, the supplement plan kicks in. Okay, Medicare only takes care of 80% on a vast majority of things. 80%. The supplement plan, a Medigap plan, they pick up the other 20. Okay, Medicare pays, and then boom, the rest of the bill transfers over to the plan. They say, okay, Medicare took care of this. This is our portion. Let's go ahead and take care of that. Okay, so that's a big good thing. Okay, a lot of members who travel, we got retirees who will travel and follow the good weather. We got members who will travel and go to another state or so forth for several months, to visit family, grandkids, or whatever the case may be. They have another vacation spot somewhere else, and they go stay over there. They don't have to worry about being out of the service area because they're on the supplement plan, and so they can see any doctor in their area wherever they may be traveling to. Okay, so again, I did mention that you don't need a referral to go see a specialist. And again, these are only medical, so it does not have a prescription component. So when you do talk with via benefits to get a Medigap or supplement plan, they will also get you into a prescription drug plan to take care of your prescriptions. Okay, so copays and deductibles may vary depending upon the selected plan. So some of these plans, they have a high deductible, some have no deductible. you want to talk to Via Benefits, they'll be able to provide you the details on that. Okay. Again, it's the United States is the service area. Wherever Medicare can go throughout the United States, you can utilize your Medicare coverage. Okay. Move forward. Okay. What ACERA offers? Okay, so we have Kaiser HMO, we have United Healthcare Signature Value HMO, and we have United Healthcare Signature Value Advantage. Okay, so once you become Medicare eligible, you need to transition over to a Medicare plan. We've already mentioned that. So the only Medicare plan that we have in-house on ACERA for ACERA is the Kaiser Senior Advantage plan. Okay, if you don't want to go to Kaiser Senior Advantage, then you'd want to reach out to Via Benefits, okay, and they can assist you to enroll into a plan, a Medicare plan, okay? So we have retirees, we've got over 2,000 retirees that are over at Via Benefits, and they're enrolled in over 256 different plans, okay? There's all kinds of plans out there. So when you speak with the Via Benefits rep, you want to make sure you have your prescriptions, who your doctors are, okay, and then they'll be able to provide you with, okay, these are the top plans that are in your area, and then you'll be able to make a selection, and then they can answer any more questions you have. Okay. Move forward. All right. So the Kaiser Senior Advantage. Okay. Again, you're supposed to have A and B to get into the plan. The Senior Advantage. Okay, it's only in California, but Kaiser is in several other states. You can find them in Hawaii, Oregon, Washington. I believe they're in Colorado, Georgia. You know, there's several states that Kaiser is located in. So if you ended up relocating from California out to one of these other states, and you start moving to reside where Kaiser is located in some of these other states, you can go ahead and contact them directly and enroll in a Kaiser plan, their individual plan with them. Okay. And if you did that, then you'd want to contact Via Benefits and say, hey, I've relocated from California from ACERA'S Kaiser group. I'm now over in, like, say, for example, I'm in Georgia, and I'm now in Senior Advantage Georgia Kaiser. And then Via Benefits can go ahead and help you to opt in to get your HRA health reimbursement account set up so that you can still get reimbursed for your premiums and your out-of-pocket medical costs, like prescriptions and so forth. Okay. Okay. So again, the premiums for this Kaiser Bank by yourself is $382.21, depending upon the years of service. If you have at least 15 years of service, ACERA is going to pay that, the whole thing. Okay. If self plus one, it's $764.42. That's if you and your dependent both have Medicare. Okay. Again, we would subsidize your costs, so you would only be paying the full premium for your dependent, which is $382.21. And of course, there's family for those who have. This one has $1437.32. That's you and your spouse have, or another dependent has Medicare, but then you still have another additional dependent on there. That's $1437.32. And of course, we would subsidize the portion for the retiree. Okay. Again, the copays on the KIPSA is only $10 for office visits, allergy treatments, hearing, vision exams, things like that. Okay. Now, if you have a dependent on the plan with you and they're on the HMO, then they would still pay the $15 copay for the HMO. Okay. You, the retiree, or whomever is enrolled in Senior Advantage, your copay would be only the $10. And you would get a brand new Kaiser card. It'll still have your same medical record number. Okay, because that follows you for your whole life. That's how they find your history. Okay, with your MRN that's on your card. But you will get a brand new Kaiser card that will designate the Medicare Advantage, and it's coded in there so that you only have to pay the $10 copay and not the $15. Okay. All right. Next slide. Okay. Now, the plans through Via Benefits. Okay. These are individual plans. They're not ACERA group plans. Okay. And these will not appear on your retirement monthly benefit that you get from ACERA. Okay. So these plans, again, they're individual plans we don't have a contract with all these different carriers. So you would be having to make sure that you pay the premium directly to that carrier, okay, to maintain your insurance coverage. And it would work similar to this. Let's say you contact via benefits and you want to get into, for example, you're on a United Healthcare and you don't want to go to Kaiser. Okay, you want to kind of stay with United Healthcare. You contact via benefits. You let them know, hey, I currently have United Healthcare with ACERA. I'm becoming eligible. I want to stay with United Healthcare, a plan similar, because I want to see my doctors. They will assist you to enroll into a plan. They will see what they have as far as United Healthcare offers. Okay. Now, United Healthcare is a very large company. Okay. They own multiple other insurance companies. Okay. So if you've ever gotten anything from like Secure Horizons, you might remember Pacific Care, all kinds of different insurance companies. In the small little print below the main name, you'll see a subsidiary of United Healthcare. Okay, so they own a lot of these other insurance companies, but they leave that company's name alone. But they're actually the big brother or mom or whatever you want to call them. Okay, so the Medicare plans over through on the individual side, you can still get with United Healthcare. Okay, you want to make sure you have your MD, the name of your doctors, all your prescriptions, so that when you're talking to the rep, they can make sure that they assist you to find a coverage that's going to cover those, and it provides you the best option for your premiums, and you'll be able to make your selection. Now, the carriers, once you pay your premium to that carrier turns around and reports to via benefits, hey, we received this month's premium, from so and so. Okay. Via benefits looks at their records. They'll see that you have a health reimbursement account set up by ACERA. Okay. And they'll see what the balance is. They pull what you paid as far as the premium, as long as you have the balance in there, and they go ahead and reimburse you what you paid out of pocket. Okay. So again, for the ACERA plans on your monthly benefit, you have a premium. We deduct that premium. You'll see it under the deductions, but then we also add in the subsidy, the monthly subsidy that you're eligible for, and it help offset that deduction on your monthly benefit. So you only end up paying the net difference. And if you're on Senior Advantage, then there is no net difference because it covers the whole thing. Via benefits, these are not going to appear on your monthly benefit check. Okay, so you're responsible for paying the premium to the carrier. The carrier will report that you paid the premium to via benefits. Via benefits will look at the health reimbursement account. They'll see your balance, and they reimburse you back what you paid out of pocket, as long as you have the balance enough in there to do so. And the balance, as far as the HRA reimbursement accounts, a vast majority of our members who are on Medicare, they never use up all the money. Okay, we're putting money in there into your health reimbursement account for you to pay and get reimbursed for your out-of-pocket medical items and your premiums and so forth. And the vast majority of the members never use up all the money. There's always money left over at the end of the year. Okay, there's very few, and I could probably count them on maybe a hand. There's maybe a handful of members who end up utilizing all the money and they run out of health reimbursement account funds to get reimbursed. And those members are typically, and I know exactly who they are, but these members are members who are, they have very bad ailment, and they're on special compound medications that cost big money. And so they use up the funds, before the year is out. They tend to run out usually around October or November. They've spent all the money. And it's mainly because of the prescriptions. They may be very, very sick and they're on a lot of medication. So they'll go ahead and run out. But vast majority of retirees, they don't run out of the funds that we put into the health reimbursement accounts for them. Okay. So members who are eligible for ACERA'S medical funds will be granted the health reimbursement account, and it's for your out-of-pocket expenses up to the amount that you're eligible for. So if you utilize all the money that's in there, you don't get more money added on because everybody gets a set dollar amount. Okay, and only the retiree members are eligible to submit claims through the HRA. Okay, so out-of-pocket expenses for dependents are not reimbursed. Okay. It kind of works like a cafeteria benefit where there's so much money in there for you to use up this year. If you don't utilize all the funds by December 31st, okay, come January 1st for the new year, your balance is wiped to zero and you start over again. Okay. Now, let's say, for example, we're now in January or February, and all of a sudden you got a billing statement for services that you had gotten done in this last year, the prior year. Okay. Well, you can still submit that claim in as long as you had funds still available at the end of the year to have that reimbursed out of the funds the balance that you still had at the closing of the year. You have until March 31st to submit for any claim items against the balance that you had at the end of the year for the prior year services. Okay. So if let's say you had something done in November, you don't get that bill from the doctor's office or whatever till February, the balance that you had for the prior year is already wiped out. You can submit that claim before March 31st. Via benefits, look to see what your balance was at the closing of the year. They see you still had some funds, they'll go ahead and honor it and reimburse you accordingly. Okay, just so you know. All right, moving forward. Okay, via benefits enrollment. Okay, they don't have an office that you can walk in to talk to somebody face to face. It's all done over the phone. Okay, so you want to make sure if you have a cordless phone, make sure it's fully charged. If you're using your mobile phone, make sure it's fully charged, because typically it takes about an hour to go through everything, because there's a lot of material they need to explain to you and questions and so forth as they go through asking you questions, just like what's on an enrollment form. They're going to go through all the from A to Z on items, and they're going to want to know all your prescriptions, who your doctors are, all that, so they can make sure that they find you the plan that's best going to suit what you're asking for. Okay. Carriers on the individual side, they do require both Medicare Parts A and B. Okay, so you want to make sure you have Parts A and B over there. Most Medicare Advantage plans have Part D built in it. And you can talk to the agent representative when you're enrolling, and they can make sure that this one does have a prescription Part D in it. Okay, because there might be a few out there that don't. The carrier just for whatever reason opted not to have that as part of their option plans, but there's so many that do have Part D, so you don't have to worry about that. Medigap supplement plans are medical, so again, you'll need to enroll in a prescription for Part D plan, and the representative will be able to do that for you. Okay. A licensed benefits advisor will go over all the plans available in the area that you are. So it's very important that they know exactly where you reside. Plans are nationwide, so no matter where you are, via benefits will be able to assist you to find a plan. Okay. Reimbursements available for retirees out-of-pocket expenses. Okay, again, your out-of-pocket expenses, medical, prescription drug plan premiums, co-pays, deductibles, any medical necessary items. Okay, you're eligible to go ahead and submit to get reimbursed for that against your balance of your HRA account. Okay, this is very important. You want to make sure you set up auto pay and direct deposit. Okay, reason being is the mail is uncertain, as you probably already know, and then people are always breaking into mailboxes. So sometimes it's easier just for you to go ahead and have auto pay, where the carrier may pull the premium for your coverage right out of your account. Okay, via benefits can then direct deposit your reimbursement right back to your account. Okay, then you don't have to worry about is the check in the mail. Did it come? Did I actually? I've had members who the check came and they thought it was junk mail, and they tore it up or shredded it or got rid of it, and then they're asking, well, where's my check? I never got the check. The check came. So you want to make sure you're tracking items. Okay, it also helps. It's all electronic. Then you can always log on to your account, view that you got paid. Reimbursement for the current plan year, again, must be claimed by March 31st of the following year. You got to March 31st for anything from the prior year. Otherwise, it's a done deal. Online reimbursement account tracking and status updates. Via Benefits does have a really nice app. You can go ahead and log in and create your password to be able to get into view your account. You can see what your balance is for your HRA account. You can see if a claim is pending to be paid. If they denied your claim, you can see that there. You're able to submit claims through the portal. You're able to upload items, download forms. One of the things I was pushing for the longest time, and you may have heard how Social Security finally, the Medicare cards back in the day used to have the person's, your full name and your Social Security number, right? And your signature on it because they wanted you to sign it. Now, you can imagine how much identity theft occurred because of that, okay? So they finally switched over the last few years to not have your Social Security number on the card and in their mailings. They've now switched over to give you an identification number, which is great because now people aren't getting access to your Social Security number, which is very, very important. So in the same manner, via benefits, when you contact them, they can go ahead and provide you with your claim form if you want to submit a paper claim form, or if you logged in and downloaded a form, it'll have like a scan bar, and the scan bar identifies you and has your information. That way you don't have to fill out the form with your name and address, Social Security number, and all that other stuff. It's already on that scan bar that helps identify you, okay? And that protects your identity, okay? So again, their website's pretty good. So that's another item that you can always check into and be able to track where your claims are for reimbursements. Okay, next slide. Again, via benefits prescription profiler. So Medicare Part D, they're adding hundreds of prescriptions to its database every year. These pharmaceutical companies are creating and developing things, and they send things over, and that changes the formulary and the costs of what you're currently taking, because the new one comes in and that kind of replaces it, but it's a little bit better, or sometimes it's not as good, but it changes the costs and so forth of what your prescriptions fall in. But via benefits, they have a prescription profiler database. And I'd say by going into the prescription profiler in mid-October, you'll be able to get a prescription coverage that's gives you best breakdown. Once members are in a plan, from what I've seen over the years, once they're in a plan, they pretty much like their plan. It's the prescription portion that every year they're checking in on, which is great. I really like that they're doing this according to what I've instructed them. Because you may be on a prescription drug plan and paying a certain amount for your prescription. You check in October, there may be another prescription drug plan that will cover your prescription at an even lower cost and have a lower monthly premium, which is a good thing. So it always helps to, even if you're just checking in, just contact them, say, can you check to see how much prescriptions, compare against whatever else is out there now, and they can take a look and compare it and say, well, no, you're still on the better plan than what's out there. Or they may say, well, yeah, there's a new plan over here that's offering your prescriptions at a lower copay. And then they can assist you with changing over to that other plan. So whenever October comes, mid-October, when open enrollment comes, you want to give them a call and just check in and to make sure that you're still getting the best buck for your prescription coverage. Okay.
Ish, I noticed we have a hand up, and I don't know how long it's been up, but maybe if you still remember your question, you can go ahead and ask it.
What's their question, Mike?
I'm not sure. I just asked them to unmute, and maybe they could just ask it.
Okay.
Is that me?
Yes, that's you.
Robin?
Yes, I think I raised my hand in the very, very beginning.
Oh, sorry about that.
That's okay.
Do you remember what your question was?
No.
Okay, sorry about that. I'll monitor that better. I was paying attention to the Q&A and not the raised hands, but yeah, I'll make sure to monitor that as we go along.
Okay, am I supposed to be seeing anybody on the screen?
No, we had Ish turn his camera off so that his voice had more bandwidth in order so that it wouldn't cut out.
Okay, gotcha.
Yeah.
And Robin, if you remember your question, feel free to let us know, or you can always email us after the the webinar with your question. Anybody at any time, you can always send us an email, and we can always get the answers for you. Okay.
Yeah.
Sounds good.
Sounds good. And so we'll go and since the raise hand thing, I mean, since we're not getting inundated with questions, feel free to either raise your hand or type your question into the Q&A as we go along. And one more thing, Ish, so it's 10:30. Does it make sense to take a 5-minute break really quickly, or like how much more presentation do you have?
That's a good question. Let's see where we are. Here. Only got like 5 slides more.
5 more slides? Okay.
Yeah, I think we can get through it.
Yeah, maybe we'll just stick it out.
Okay.
Okay.
All right. So here we go. All right. Open enrollment. So this is very important for everybody. Everybody, as retirees, you guys all know that ACERA'S open enrollment is the entire month of November, right? And unfortunately, due to COVID, we haven't had our open enrollment health fair, which we usually have somewhere around, mid to late October. But hopefully, things will get better with this COVID epidemic, and we're able to be all together again in some kind of form. And we can go ahead and have the large event again at a nice site where we can have, because typically we have hundreds of retirees attend, and all of our carriers and lots of vendors are there giving away free items and lots of good advice and so forth like that. And we have, beverages and snacks and food from you guys, and a free ACERA gift. But again, due to COVID, we haven't had that in the last 2 years or so. So anyway, the entire month of November is open enrollment. Okay. Now that is for ACERA'S plans. Now through VIA benefits, they're the individual plans. So their open enrollment begins October 15th and runs through December 7th. Okay. And that's for the Medicare ones. So you want to make sure that you're paying attention upon where you're trying to go. ACERA'S plans, our benefit year starts February 1st. Okay. VIA benefits, those are individual plans. Their benefit year starts January 1st. So if you're switching from ACERA'S plan going to VIA benefits, your plan year over there, your coverage will start January 1st. If you're coming from VIA benefits coming to ACERA, your plan year will begin February 1st with us. Okay, so you always want to keep that in mind. Okay, but that is the time that you get to add, change, to your medical, dental, and vision with ACERA. Okay, that's the month of November is when that is. And of course, we do send out our open enrollment packet that has our brand new, because we always revise and create a brand new retiree enrollment guide. Okay, and Mike and his team, and kudos to them, because they play a big factor in the development and the creation and so forth of that guide that goes out every year. Kudos to you, Mike, and your team. Thank you for helping us out with that. So, but the open enrollment guide, it is in that packet. We mail out a hard copy to everybody. It is available on our website. So if you don't recall where you have your open enrollment guide for the new year, 2021, you can always go to our website and you can download a copy of it or just view it online, however you like. But it has all the information about our plans, the premiums. It has comparison charts, you name it, it's on there. And on the last page of the guide, it has the group numbers for all of our plans. It also has customer service numbers and websites. Okay, a lot of good information is in there. So that's another place you can take a look at if you want to try to find what we have there. All right. Okay. Again, when selecting a plan, you always want to keep in mind what the premium is, because you can't enroll into a plan that you're not getting paid enough money to enroll into. Okay. So for example, if you're getting an $800 a month retirement benefit, you can't enroll into the United Healthcare plan that's $1,100. Okay, it's more than what you're getting. So you got to keep in mind. Or if you're trying to add a dependent, remember, the full premium for your dependent comes out of your monthly benefit. So if your benefit amount is not enough to cover both the two-party premium, then you can't add them on, unfortunately. Okay. Move along, Mike. Okay, so this is the chart that shows the monthly medical allowance that's sponsored by ACERA. Okay, and as you can see, for 2019 to 2020 to 2021, we increased, the board approved, and we increased what we subsidize in 2020. And for 2021, it remained the same. Okay, the amount that we reimburse remained the same. The top chart, which is in blue, has blue, that is the pre-65, the non-Medicare plans. Okay, that's what, if you're not Medicare, this is what the amounts that we subsidize towards for you. Okay, and then of course below, the gold ones, or the peach ones, however, those are the Medicare. Okay, so when you become Medicare eligible, then your monthly allowance, your monthly medical allowance drops down to that amount. Members always say, well, why is it got to reduce it down? Well, we reduce it down because the Medicare plans are a lot lower in premium. Okay, and so for example, the senior advantage, okay, like the Kaiser HMO, it's $810, right? So we're subsidizing $578 towards that for you if you have 20 plus years or service-connected disability. Okay, now that same person, remember the example from a while back, because Medicare eligible, they go on to Kaiser Senior Advantage. That's only $382, and you see we would pay up to $443, so that covers that $382 for that Senior Advantage. Okay, and no, I know you're probably thinking about this. Well, if my premium is only this much and I still have some of my MMA left over, do I get that on my retirement check? No, we don't. It only goes towards your medical premium. It doesn't mean that you get to have anything that's extra put onto your check as a credit. And no, we can't use that extra to help offset the cost of your dependent's premium. No, this is only for the retiree member, just so you know. Okay. So going on with that, now the HRA account is the same way. So the HRA account, if you're pre-65, you can see the dollar amounts that you're eligible for monthly. And if you're Medicare, you see the amounts down there, what we would put into your monthly HRA account as well. Okay, so these are what we subsidize, ACERA subsidizes. Next slide. Okay, qualifying events. Okay, things happen, we understand, and it's usually something you weren't planning on. A loss of coverage. Okay, so outside of open enrollment, where you can join plans and change plans and so forth, if you lost coverage, let's say you chose not to be on ACERA'S plan, and you chose to be a plan with your dependent, okay, and now that dependent, let's say their employer or wherever they're getting their coverage from tells them, oh, we're not going to offer medical coverage anymore. So now you and your dependent are losing coverage. Well, you'd want to, that's a qualifying event. You want to contact ACERA as soon as possible so that we can take a look and then I'll let you know what we have available for you. Okay. And that way we can get you enrolled. That way you don't go without insurance. Same thing if you're relocating out of the service area. Okay. You're on our plan here. You relocate to somewhere else. Okay, you need to let us know so that we can get you what your options are to enroll in the plan where you are or where you're going to, because you obviously can't stay in the plan that you're on because you're relocating out of the service area. Of course, then there's the annual open enrollment, which is the month of November. Becoming Medicare eligible. You become Medicare eligible, that's a qualifying event. That allows you to change your plan. Okay, so you can go ahead and change over to a Medicare plan. Retiring, okay, after age 65, also, allows you to change to a Medicare plan. I mean, retiring itself is a qualifying event. Okay, so, and of course, as an employee coming over from the county, you're leaving the county service, you're losing coverage, of course, that qualifies you to go ahead and jump onto a plan with us. Getting married, you got to let us know if you find love and remarry or get married at all. Okay, you have 30 days from the event to add your new spouse on. Okay, it's a qualifying event. So you got to make sure you reach out to us, let us know. Qualifying event window is 30 days. You have 30 days from when it happened to contact us and so we can get you into a plan. Okay, so you got to make sure you're paying attention to that. All right. Again, moving outside the service area, don't forget to look into the available health plans prior to moving. You got some members who they fall in love with that new place, they just boom, pack up and go, and they contact ACERA after the fact, and it's like, okay, well, but you're losing coverage, you've lost coverage because now you're not even in the area. So it's always good to let us know you're looking at going to this certain area. If you have an address or the zip code, that'd be great, so that we can take a look and see what is available where you're looking to go to. Okay, and it's critical that you look into the coverage area of where your current plan is. I mean, you might just be relocating to a different zip code and might still be able to keep the same plan. So, but you want to reach out to us so we can take a look and help you with that. Okay, you reach out to us for assistance in this matter. You must complete an ACERA address change form to update your record. Okay, only a signed change form will be accepted. No phone calls or emails. You gotta provide us that signed form. Okay, that authorizes us to change your record. Okay, because how do we know that somebody's not playing a joke on you or being malicious and pretends to be you and say, hey, I changed my address, this is where I'm at, and it's not really you. So we need the signed form to confirm that you are the one. Okay, because remember, your account at ACERA is confidential and secure. Retirees who reside outside of California may not be required to pay California state taxes. That's another thing. You're relocating out of the state. You don't want to get a tax letter from California state tax board, right? So you want to complete a state tax form for California saying not to take California state taxes if you're living outside of California. Remember to send ACERA a completed ACERA address form name change request form, which can be found on our website. So if you go to our website right there, you'll find all of our forms. You can simply download the address form, tax form, whatever the case is, and complete it, and you can go ahead and get it into us. Okay. All right. Big screen. All right. That's pretty much it. You can email questions to us at acerainfo.org. ACERA is always ready to help you. I do want to touch base on this. We do have some members who may have never paid into the system for Medicare or Social Security. For example, they're safety members who were safety members their entire career in life working, so they never paid into the system. So so you never paid in the system. If you reached out to Social Security, they may say, well, you've never paid into the system. You're going to have to pay for Part A. Okay, like for example, that $471 for the Part A, and then of course whatever Part B premium is based on your income, your reported income. Okay, what you can do is with the ACERA'S Kaiser Senior Advantage plan, we do have a Part B only plan that will assist you. Okay, so what you can do is you can waive the Part A, so you don't have to pay that $471 premium for the Part A. Okay, because you don't qualify for the free, and then you would just pay for the Medicare Part B. Okay, we would still reimburse you that $148.50. Okay, and that would allow you to enroll into our Kaiser Senior Advantage Part B only plan, which means the current premium, which is like that $810, and then if we're subsidizing that at $578, it still costs you $376. Okay, you will get into Senior Advantage, it's $382. We will subsidize at $382, so there's no cost to you there. So you're saving that $376 if you have 20 plus years of service. Okay, plus we're reimbursing you the $148.50. So, and your copay is jumped down. So it's still a win-win for you. Okay, so if you do fall into that category where your Medicare tells you that no, you don't get A free, definitely reach out to us so we can have a conversation and we can walk you through the process. Another way you can qualify would be if your spouse, based on your spouse's eligibility, if your spouse was working and has paid into the system, you may also qualify based on being the spousal portion of it. So you can always bring that up when you're talking to Social Security about it. Okay. So again, if you fall into that category, definitely reach out to us so we could talk. And I wish you all to stay safe and do your due diligence, keep your mask on, and be safe out there.